Hi there, Dr. Lucette. Today I want to talk to you about how to mentally prepare for surgery, and I will give you 4 tips on how to best prepare for the day of the surgery. If you've gone through surgery or if you're getting ready for surgery right now, you've probably met with your surgeon and know how they give you a mile-long checklist of things to do prior to surgery, and that can look like arranging for someone to drive you the day of your surgery, quitting smoking, making sure that you're eating a balanced diet, bringing your insurance card, meeting with your anesthesiologist. So a lot of things that are involved into getting you ready for the day off. Okay. I want to argue that there is one thing missing from most of those checklists, and it is your emotional toolkit. And what I'm saying by that is that there is a whole lot of anxiety that comes with getting ready for surgery. So if you're feeling anxious, you are not alone. Up to 75% of patients actually feel anxious prior to their surgery, and it doesn't really matter if it's a minor surgery or a big surgery, there's a whole lot of anxiety. And again, it can be anxiety about the anesthesia, the anxiety about recovering and having a lot of pain, your body looking different. And that can really get in the way of your life in the months and weeks preceding the surgery. It can get in the way of your sleep. So it can really be very disruptive. So I want to give you 4 tips to mentally prepare for surgery and deal with all the anxiety that can show up. Tip number 1 is to identify some stress management strategies and to use them, okay? And stress management can look like a lot of different things. Typically, when we think about alleviating the anxiety, we think about deep breathing. It can be a body scan, a visualization exercise, progressive muscle relaxation, mindfulness meditation, yoga. There are a million different ways to calm yourself down. I want you to find something that works for you, not for your best friend, your doctor, your therapist, your spouse, just something that you know is going to help you, okay? Maybe to identify what works for you, you can think about a time that was stressful, a time when you had a lot of anxiety, and think back on what you did to calm yourself down, what was helpful in that moment, and utilize those things, okay? You don't need to reinvent the wheel. If there's something that you know is helpful, do more of this, okay? You may also want to kind of look up resources on YouTube. There are some apps out there that can help, such as Calm, Insight Timer, and look up some deep breathing exercises or relaxation exercises, and then practice, practice, practice. Tip number 2 is to take care of your most basic needs. Make sure that you're protecting your sleep, that you're drinking enough water, that you're eating well, that you're making some time to relax and see your friends or family. So essentially, take care of your body and mind, okay? Surgery is an emotional roller coaster. You don't need to add to that stress by planning any big projects around the house. It's not a good time to schedule any other stressful events around that same time. So keep it basic. Again, don't do anything that could take away from your ability to sleep well and take care of yourself in a way that is especially important around that time. Tip number 3 is to be informed. From the moment you've had your appointment with a surgeon, keep a list of questions, concerns, any ideas that you have that come to your mind about your surgery, and keep track of them on a sticky note, on a note in your phone, and every time something comes up, you write it down, okay? Then with those questions, you can go back to your medical team, to your surgeon, and get some answers. You can do some research online, although don't overdo it because that can cause more anxiety. You can kind of go to an online community of patients who've gone through that same procedure to ask for some support and some ideas on how to best prepare. You can ask loved ones and families for some support or tips or answers if maybe they're familiar with that procedure. So do your research and be confident in your ability to get the answers that you need. And tip number 4 is to ask for help. Lean on people. lean on your medical team, on your friends and family, on an online community of patients who've gone through the same procedure. Just ask for help and receive the help that's offered, okay? The truth is that most people want to help, they don't always know how to. So be assertive about what you need. Tell people what you need in a way that works for you. Maybe you need help with doing some research. Maybe you need help by having someone listening to you or giving you a ride. Just be clear about what you need and ask for it in a way that's clear as well. So in summary, 4 things to mentally prepare for surgery. Number 1 was to identify some ways to manage stress and practice every day, way before surgery day. Number 2 was to be basic and only take care of your most basic needs. Kind of take care of your body and mind as much as possible. Stay away from other big stressful projects around that time. Number 3 was to be informed and advocate for yourself. And number 4 was to ask for help and lean on people for support. That's all for today. I hope that helps. If you want more information and resources on how to take care of yourself, your body and mind, you can head over to my website, www.drlucette.com, and sign up for the newsletter to receive more information on just that topic. I'll talk to you soon. Bye-bye.